Hey again, this is Paige. I am a member of the SM Nursing Reviews team. This video, it's going to be a review of childhood vaccines as well as an extended multiple choice question practice. So remember, multiple response select all that apply questions. These are part of the next gen NCLEX, so super important for you to be familiar with these types of questions. Multiple response, it's exactly how it sounds. Instead of just selecting one answer like in a standard multiple choice question, there's multiple correct answers for you to pick. So let's jump in and talk about this a little bit. So there are actually several formats of multiple response questions on the NCLEX, but in this video, we're going to go over the simple select all that apply style question. So in these questions, there's somewhere between 5 and 10 answer choices that you'll be presented. The good news here is that you don't need to get every single selection in order to be correct on these. That's great news because that means you can get partial credit, which absolutely did not used to be a thing on the NCLEX in the past, so yay there. For every correct response you select, you are going to get 1 point. And for every incorrect response you select, you get minus 1 point. Remember, the lowest score that you can possibly get on a single question is going to be 0. On some items, like the matrix multiple response, where you're actually clicking things from a table that's presented to you, the exam is going to tell you how many to select. However, on these standard select all that apply questions, they aren't going to tell you how many are correct. So make sure you take a good deep breath when you get to a question like this and give it your very best guess. So with that being said, here is your question. Let's take a look at that. A nursing student is reviewing routine immunizations with their preceptor. The student is correct when they include which of the following as being appropriate routine vaccinations for infants and adolescents. Select all that apply. Okay, so I'll give you a second to look over this and feel free to go ahead and pause the video if you need to before I reveal the answer. Okay, so here is your answer. Let's talk about the answer and then we will talk about how we got to that point. So the typical routine vaccinations that nursing students should expect a patient to have include the Tdap, DTaP, rotavirus, hepatitis B, Haemophilus influenzae type B, varicella, IPV, and MMR. Okay, so deep breaths here. If you did not quite get that, that is totally okay. Let's break this down. Let's talk this through. So the Tdap and the DTaP, that is our diphtheria, tetanus, and pertussis vaccinations. But do you know the difference between those two? So a good way to remember the difference between DTaP and Tdap is that Tdap is only for clients older than 7 years of age, and our adolescent clients, of course. So I want you all to think of that T in Tdap standing for tall, meaning our older children. So what makes these different from each other? That Tdap, that's used to just boost immunity. Okay, moving on, the rotavirus vaccine, we know that is only given to young infants and it protects them from serious GI illness that can lead to severe dehydration. So definitely want that. Hepatitis B vaccination, that is recommended for all infants, children, and adolescents younger than 19 years of age. The Haemophilus influenzae type B, or you may have commonly heard this referred to as the Hib vaccine, that is recommended to infants and children up to the age of 5. They're going to routinely receive this to prevent illness. I do want to note that before this vaccine, Hib disease was the leading cause of bacterial meningitis in children younger than 5 years old in the United States. Okay, so varicella, otherwise known as the chickenpox vaccine, that is routinely given to children as well, we know that. And next after that, we have the pneumococcal conjugate vaccine, specifically the PCV20. So that is a type of pneumonia vaccine that's given to adults 65 years and older to prevent complications. So in certain situations, children can be given this due to their health risks or comorbidities, but it's not a typical routine childhood vaccine. So moving on to the IPV, that is the polio vaccination, which is typically given at several increments, and we complete the series by the age of 6. On to herpes zoster, that's also known as the shingles vaccine. So who do you think would benefit from this? Can you think of it? Okay, so that's definitely our older adult clients, and this is recommended for clients 50 years and older. And last, what is that MMR vaccine? So that is our measles, mumps, and rubella vaccine. So this is also a very typical childhood vaccine, and the series should be completed by age 6 as well. So keep in mind, childhood vaccines, they're not typically a huge focus on the exam, but they're certainly easy points for you all to get. So repetition, flashcards, those are great ways to memorize these vaccine schedules. So let's throw out a little bonus question for you. So do we need to aspirate when giving a vaccine? Do you remember? Do you have any thoughts? Okay, so it is actually not recommended by the World Health Organization and the Centers for Disease Control at this time. However, keep in mind proper administration with the use of landmarks, that's crucial. Okay, another bonus question. What is one emergency medication you want to be sure to have around while administering vaccinations? Can you think of what that would be? So we would not administer vaccinations without epinephrine around in the event of an anaphylactic reaction occurring after administration of a vaccine. Now, one more question. How long do we need to monitor a client after administering a vaccination? That's 15 minutes. They need to remain within our care for that duration to ensure they're not having an allergic reaction or any complications to the vaccine. So client safety and proper administration, these are big things to remember with vaccines. So I know these multiple response select all that apply questions. Can be so much information that's given. It can absolutely seem daunting to tackle. Where do you even begin? But really, I just want you to move through them like any other question. So my best advice is to go methodically through the question, look at each answer choice separately without the others, and determine if it fits the question. Answer yes or no to each answer choice. So in this question, we would move from answer to answer, checking if it would be appropriate for a child or an adolescent client, and if not, eliminating it as an answer choice. So another key piece of advice, please, 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 please do not change your answers ever. Please, just don't do it. Go with your gut because that gut is usually right. All right, my friends, you can absolutely do this. Be sure to tune in on our other videos where we are dissecting different types of next-gen NCLEX questions. Thank you so much for joining today.